Hello, and thank you for inviting me to be tonight with you in this webinar. More people live today than at any other time in human history. Global life expectancy has risen significantly in the last century. Today, we celebrate the legacy of the work done in the past for the advancement of life expectancy, partially due to having lower climate global temperature, as well as due to three major global health interventions: access to clean water, vaccines, and antibiotics and antimicrobial treatment. However, we know that today global mean temperatures have already increased by an average of 1.1 degrees Celsius since year 1900, with most of the change having occurred in the past 50 years. So we see today more and more the impact of climate change on nature as well as on people. For example, we know about the flooding and drought that is leading to more forced migration, in addition to fires and storms and their impact on the livelihood of different communities around the world. Additionally, the climate experienced at any location and time represents a combination of natural climate variability and increasingly climate change. As greenhouse gases accumulate and lead to increased global temperatures, extreme weather events are becoming more frequent, more severe, and sometimes both, unfortunately. So the change in our climate leads to change in the conditions of the different pathogens reservoirs around the world. And globally, 10% of the global carbon emissions are caused by tropical deforestation. It is estimated that each year, deforestation of tropical forests releases more carbon into Earth's atmosphere than the emissions from the whole transportation sector of the United States of America. Deforestation leads to climate change as well as the increased risk to the emergence of zoonotic and infectious diseases. This means the impact of deforestation is beyond the point of just affecting animals. Also, with the increased average temperature in places where they used to be known as cold places, can lead to the emergence of frozen pathogens, which this could be regarded as a Pandora box. So given the potentially large pool of pathogens accumulated over time and the extent to which these pathogens may be new to people. So today we are up against as we try to transform our society towards climate justice and sustainability. However, the anthropogenic climate change is not inevitable. The future state of the environment is not predetermined and can be influenced by our current actions. Therefore, the question today is how new patterns of action and interaction can best be established, both individually and collectively, through personal choices, social systems, and governing institutions. We can work on either mitigation or adaptation strategies or both, so then to work towards this change for the future. This is an example of a macro action work supported by the Two Wings Foundation in Austria. They have an initiative called Planting Hope, where they have a long-term plan to do a holistic approach from planting over 10,000 trees around the world, as well as working on communities' ecosystem for education and livelihood sustainability towards the betterment of health and climate change justice. Their approach falls under adaptation and mitigation by working on the interaction among different actors of society, such as children, parents, and communities. And this approach will be central to the task of building more sustainable relationships with the natural world and among various segments of the global family. Also, it is obvious today that climate change became about public health. Children tend to be the weakest link in the impact of climate change. I have been engaged with how to protect children from different burden of diseases for over a decade. And I have learned that the best protection you can provide to children is prevention. So here we need to think about mitigation and adaptation one more time. Children are the most vulnerable group in communities. I cannot stress on that more and more on that. Especially during the first 2 years of their lives. Because one, they need to have a good immune system. And two, their milestones of development go in a relatively fast way. Therefore, the parents need support to be informed on what happens in these critical milestones, as well as how to act and support their children. So this is why there is a popular saying in Africa, it takes a village to raise a child. And the village here would include 3 protagonists: the parents, community, and institutions. Children are vulnerable to infectious diseases, and thanks to vaccines, we have relatively a large number of vaccines that are already available and integrated into the national immunizations programs of countries around the world. Also, parents are vulnerable because they lack information vis-à-vis climate change. Evidence shows us that parents experience sadness, hopelessness, and anxiety about their children's future. Parents feel guilty. I'm a parent myself. I can relate to this. Parents feel guilty towards their children and their integrity is compromised. Parents feel disempowered due to information complexity and political uncertainties. When it comes to institutions in the healthcare system, they tend to work in a highly specialized way that can be called or perceived under the label of fragmentation. So they tend to create some silos in between each other. So to be specialized is actually very good. But the climate change cannot be resolved without a unified approach among all stakeholders. Therefore, cooperation, mutual aid, and reciprocity are essential characteristics in the support of children. parents, and institutions which are part of the same body of the world of being. Hence, the concept of the three protagonists came into place. That one stakeholder cannot help the children alone, but it requires, again, a unified approach. So for a couple of years, my research work has been on SEMA, which is an innovative platform designed to enhance social equity in vaccination uptake through a unique collaborative model. SEMA synergizes the efforts of the three protagonists: parents, clinic staff, and policymakers, by creating a comprehensive ecosystem aimed at boosting vaccination rates. One, by having a vaccination schedule management. So SEMA enables health staff to meticulously record vaccination schedules, ensuring efficient management and follow-up with the parents through the reminding system, so which is sent automatically to them, which is support timely vaccination. So SEMA sends automated SMS reminders for upcoming appointments and alerts for those who have missed their vaccinations, and it goes directly to the parents. And we all know how is it today that we can forget things, etc. So you don't want your baby to miss their vaccination appointment. Also, SEMA provides health education where parents receive every second week an automated SMS where we share with them evidence-based information on vaccine benefits and practical parenting tips and skills to empower them with knowledge and support. Also, there is a clinic oversight where SEMA will offer the clinic and the health staff a detailed view of vaccination schedules, the vaccination completion rates per child, and it identifies those behind their vaccination schedule, which is going to help the community health workers in targeting interventions to the areas where the children are behind their schedule. Also, there is a visualized or geographical dashboard where it provides the statistics on vaccination, including enrollment numbers, defaulters, and upcoming appointments at the district level, facilitating informed decision making for policymakers as well. And finally, SEMA provides professional development or continuing professional development that offers the staff the opportunity for an online training in vaccinology, public health, and strategies to support parents through challenging life transitions. So SEMA platform, it tends to stand out by not only to streamlining vaccination scheduling and follow-up, but also by fostering and informed and supporting the community of parents. And also it empowers the healthcare workers, and it informs the policymakers as well. So these three protagonists approach ensures that every child has equitable access to vaccinations, thereby contributing to the overall health and well-being of our communities. So, as a brief history, SEMA started, as I mentioned, a few years ago, where before COVID, where it was first started in the Zatari camp north of Jordan, and it used to be an app being with the parents, and then from there on it became as a platform inside the clinics. So we started also then later the work in Cameroon, and then soon it will be launched in Rwanda, and then also in Lebanon. And Lebanon has a very special angle in it, which is contributing to the climate change as well, because we are including health education on air pollution to pregnant women. So it will be with one made at one private clinic and also at 2 primary healthcare clinics. Finally, I would like to thank all the collaborators and funders, because without them this work couldn't be done. And I am hoping that tonight there can be Dr. Hadi Haddad or my colleagues from University of Balamand, if they are on the call, so then they can also contribute with their feedback and thoughts around this project and how they can foresee it towards the protection of children from either directly from the climate change or indirectly through the different emerging climate sensitive diseases. Thank you so much.